and they were doing breast examination, right, and they decided that it would be unseemly to have this GP, Chris Steele, doing the breast at peak viewing. And I haven't got a bloody clue what I'm doing. I wasn't a breast nurse. I was just doing somebody a favour.
Oh my God.
So,
it's better than Richard doing it.
So then, this Judy Finnegan, so you'll be on in like 20 minutes. So you go and sit in this room with all your nerves and everybody else. And then they bring me on and it's my slot. And I thought I was going to be sick. I didn't know if to be sick or faint or what. Judy Finnegan.
So, if you could just tell me your name and your job title, please.
My name's Gill Heaton. I'm the Chief Nurse at Central Manchester University Hospitals Foundation Trust.
Excellent. Actually, remember directly to me
Sorry,
all the time.
sorry,
No,
sorry.
that's fine, because that's just for my reference. And
Right.
If I ever lose everything, I've always got the people's name. So, obviously, we're going to talk about we're proud of your awards, and specifically the Gold Awards. And could you explain succinctly why you've introduced the award accreditation process for Gold Awards?
We started the process around ward accreditation a couple of years ago, really. It hasn't happened overnight, and it's primarily because we wanted to know the standards on our wards and to be able to have some level of assurance and some evidence that wards were consistently performing in a way that we would want them to for ourselves and our families. So we felt that we needed to introduce a more formal process to that, and we started off with something called the Productive Ward, which was about 4 years ago now, and from there we've evolved into doing what we now consider to be the best thing for our wards, which is the ward accreditation process.
Okay, that was great. What we need is to make that
Shorter.
really short and punchy. I think you got to a point there and I went, yeah, and then you carried on. So
Okay.
I think the same, but really sort of tight.
Okay.
Just take your time. I'll ask you the question again. So why was the award accreditation process implemented?
Because we wanted to assure ourselves.
Sorry, you need to use my...
As the lead, yeah.
Yep.
Yeah, okay. Is there anything you want me to say, girls, at that point?
The answer here, the answer in the script is it's to provide a level of assurance for the Board of Directors about the quality of care.
Yeah, well it is, but yeah.
You can expand on that a bit,
right, okay.
The history and all that is, on a bigger film, would sit, but in terms of how we need to make this really tight.
Okay.
So, so if you could explain why the ward accreditation process was introduced.
We introduced the ward accreditation process to provide a level of assurance to our board of directors to confirm that our wards were performing consistently at the standards that we require for our patients.
Exactly. Fantastic. Okay. If you could explain, again, briefly, who's involved in undertaking an assessment for the awards?
The assessment's very thorough, and it's led by a senior nurse. It also involves the head of nursing and a member of our service improvement team.
That's exactly how we need to be doing it. There was one or two little stumbles there, so we'll just do it again. But I can take the stumbles out, but it's best if they're not there.
I'll end up exhausted at the end of this answer. Right, okay. So it's because I couldn't remember.
Okay, so who is involved in undertaking the assessment?
The assessment involves 3 senior people from within our trust, a senior nurse, a member of our service improvement team, and the divisional head of nursing, for which the ward is involved. So, sorry,
that was really good. That was really good.
Yeah.
That's fine.
That's when you get all these clap things put in the bin.
Who is involved in undertaking the assessment?
There are 3 senior people within the organisation that are involved in the assessment process: a senior nurse, the divisional head of nursing, and a member of our service improvement team.
Fantastic. So this next bit, what does the accreditation entail?
The accreditation process is a very thorough process. It takes around about 4 hours, and it assesses a range of issues that occur across the wards. It's primarily focused, in my view, at the leadership of the ward, but it also takes into account how evidence is utilised and how we utilise data to improve our services for patients. It looks at some processes about how we deliver medication, how we serve food and meals, how we assess patient care overall, and they also look at the environment of care to make sure that the place is clean, it's tidy, that infection control measures are in place, that there isn't a lot of clutter around the place, and that the wards are generally to a very high standard.
Excellent. Right, I'll stop there. So, back on. How does the ward accreditation benefit the patients for their experience?
I think the primary thing for patients is that they're feeling that they're well cared for and well communicated with. And that's about informing them about what's happening to their care, and also nurses talking to each other about managing their care. And one of the things we use to help us with that is the patient status at a glance boards, which any member of the multidisciplinary team can look at to find out where patients are in the journey on the ward. And also we use patient trackers quite regularly to assess and to ask patients what their views are of our care and their treatment on the ward. And that's done in real time, and that's fed back to the staff as well, so that there's a whole picture of how patients feel, and hopefully we've improved their experience overall.
Less to that whole sequence that you mentioned, there's another element which is the documentation. If you could explain a little bit about that. Starting with another element is.
Another critical element of the process is around communication with and to patients, and that forms and is measured by a range of it. Another really critical element.
So if you could start again, but just be looking, even though we probably won't use it, just be looking directly at me to start your answer,
Right.
in case we use your.
Easy from the bloody A&E department and do this. Right, now then. Another critical element of this process.
Once again.
Once again.
If you're laughing, it doesn't sound.
It's a critical process, isn't it?
That's a critical phase.
I always look dead serious on these things. There's one at me at the
It's
moment.
really good on the screen. I can see the screen.
Yeah, well, now you may think that. I'll be judging that, Lisa.
So another element is.
I'm like one of these outtakes now with the keep laughing. Another element of the process, which is really important, is communication. And we use a range of methods to assess that. And it's about communication with patients and to patients. And the primary way we measure that is through looking at the patient status at glance boards and using the patient tracker and looking at nursing and medical documentation within the patient record.
Excellent.
All right.
That's the sorry. I was thinking out loud then, reading the question. Okay,
Oh.
so how are patients and staff involved in the accreditation?
During the accreditation process, the assessment team will speak to both staff and patients and their carers and relatives, if there are some on the ward, to find out how things are from their perspective and to back up information that we're receiving from other means, such as documentation or the patient status at a glance board, etc.
Okay, there was a few little stumbles there, but one further thing I've asked is then after the ward's achieved the gold ward status, is that constantly monitored? Is that something that carries on?
Well, we would go back and reaccredit them
Yeah.
at some point in the future, probably in 6 months' time.
Okay. Okay, so I'll ask you once again, how are patients and staff involved in the accreditation process?
It's really important to involve all staff and patients and their carers and relatives, and we would expect the assessment team to speak to staff and patients and their carers if possible to find out their experience of the ward.
Are you proud of the fact that you've got these gold awards and
Yeah.
you've achieved it? Yeah.
Yeah,
Don't care. Yeah, whatever. Sorry.
So what's your...
Cut that wrong on the script.
It's recorded now.
No, do it forever. National TV.
Explain how proud you are of the Gold Awards scheme and the people involved and who've reached the accreditation. In any way you want to say it.
I'm really proud of the wards that achieve the gold standard. What it says about them as individual leaders and their wards is they are achieving day in, day out excellence in terms of delivery of the care and the communication and the standards that we would expect for ourselves and our families if we were patients on those wards. So congratulations to all those people, and I am extremely proud of you, both personally and professionally.
Okay.
Are we all crying yet?
Did I smile? Because one of the things I don't do when I'm doing this is to don't smile. Because I'm concentrating, or I do this grimace.
Let's ask you again.
No, I don't. No, I don't want to say it again. You can't do them emotional things time after time. Well, I can't, because I can't do all that like stuff. So,
Are you proud?
Of course, I'm proud. But I just want to know: did I smile? That's all.
You may have done a little smile, but maybe a little more relaxed as you are now.
Okay.
Just tell us how proud you are.
I'm absolutely delighted and proud of our wards and the achievement of our gold standard for the 8 wards that are here this evening. It's a real privilege, and I am absolutely... No, I'm just waffling now. I said what I wanted to say the first time.
You were happier?
Yeah, but it's because I'm concentrating. I'll sod it. I'll look miserable. I'll just say what I said.
So, tell us how proud you are.
I'm very, very proud, personally and professionally, of all of our ward managers who've achieved the gold standard.
Is it the ward managers?
No.
Or is it the
I know.
Okay, so just how proud are you of the awards that have achieved status?
I'm very proud.
So I spoke over you.
Alright, sorry.
How proud are you of the awards that have achieved the status?
I'm very proud, both professionally and personally, of all the staff, and in particular the ward managers, who've achieved the gold standard for their ward. I can't just break into this
I think the one's better.
smile.
I think the